5:42 with a nation under fire, students and staff preparing for a worst-case scenario, a school shooting. A few minutes could be the difference between life and death.
It's one of the reasons why children as young as 12 will be taught how to stop excessive bleeding and keep people alive. At the beginning of this year, a new Texas law went into effect requiring two things from independent school districts and charter schools: place bleeding control kits in the schools and train certain staff on how to stop the bleed. Just west of San Antonio, Medina Valley ISD plans to offer training to 7th graders and above in the spring. Staff at Medina Valley ISD were taught yesterday how to pack a wound, hold direct pressure, and how to use a tourniquet.
It's good to know how to pack wounds like that, especially having kids on the bus. You know, anything could happen at any time.
There you go. There you go.
The training for school staff was hosted by the University Health System. Employees at several other districts, including Fort Sam, Medina, Southwest, Southside, and Northside ISD, have been trained. The training for students in grades 7 and above is not mandatory, but districts are required to offer it. In case that offered it to all the employees here.
Last year.
It was very eye-opening, and if you're squeamish, it's a good thing to do ahead of time. And then you know what to do, especially the tourniquet. It's not what you think. You tie it at a different part than you thought you're supposed to. I learned a lot.
Right now it's 5.